Hi, my name is Jaisal and welcome to my channel. In this video, I'm going to share to you the symptoms I had experienced with a rare bacterial infection I've had for 17 years. It's called Actinomycetoma. This is considered as one of the rare neglected disease by World Health Organization. At this point, they are still formulating the drug for this because until now, it has no cure but an amputation. I hope also that by sharing my journey, I can help raise awareness and maybe help others who might be going through something similar. So how it all started. Back in 2008, I noticed a small lump on the top of my right foot between my fourth and my fifth toes here in the middle. At first, it looked like a tiny bite. Like a small tiny ant bite or maybe a pimple or like kagat ng langgam. Nothing alarming, but over time it started to grow. Eventually it bothered me enough that I went to our company doctor. I was bothered because of the size growing. I was not bothered with any sensation or any pain at all. It was painless. So I was advised to get an x-ray. The result showed a mass, not a part of the bone. Because at that time, it was just like this. When I would say that it looks like one of the joints growing. To find out what it really was, I had to undergo a surgery. After the first surgery, a biopsy was recommended. However, since I did not feel any pain or any discharge or any discoloration on my skin, I didn't think it was serious. I skipped seeing the infectious disease specialist, which was advised by the surgeon. I was thinking that the mass was gone for good already. But after a few months later, it grew back. Still, it was painless, not showing any concerning symptoms. So I had a second surgery done by a different surgeon who mentioned that it might be a recurring issue. So magbalik-balik lang yun siya. So that's the time that it hit me. If this keeps coming back, I thought to myself, I cannot keep having surgery every year, di ba? It's gonna be so hard having surgery every year talaga. And considering the anesthesia and every trauma that your body or your foot will go through every surgery, parang I cannot take it. So at that time, I decided that if it grew again, I'd seek specialized help from an infectious disease doctor. Actually, after a few years, and finally saw an infectious disease specialist. The first doctor thought it might be fungal, but another doctor, which is one of the best in Cebu, identified it as bacterial infection. So that's when I officially diagnosed it with Actinomycetoma, a rare bacterial infection. I was prescribed antibiotics for 3 months and later admitted for IV penicillin treatment for 2 weeks. Another surgery followed, which will be my third surgery, performed this time by an orthopedic surgeon. At that point, I thought it was all over. I thought yun na talaga. Pero scam pala. Then in 2016, I felt something going on my foot. And this is the first time I could feel something. From the first to the third surgery, there was no pain and no discharges from my foot. But again, on 2016, I felt something was growing, and this is the first time. After giving birth in 2017, the lump became visible once more. He's there again. So I was right this time na there was really something growing. So because of my pregnancy, breastfeeding, and motherhood, I did not get any medical treatment for the next 8 years. During this time, the symptoms got worse. Pain started like burning, throbbing, and deep aching. Yun. As in on my foot 24/7. It's if like we were coexisting like the COVID. Pimple-like bumps, sometimes discharge fluid this time, within that 8 years na walang medical intervention. Especially when I was stressed or not strict with my food or like lack of sleep. Looking back for the first 7 years, there was no pain at all, just a growing lump. So 2008 to 2015. That's why I and maybe others with this kind of condition didn't take it seriously in the beginning because it was not bothering us and there was no pain at all. I would actually consider myself blessed because from the start of the infection, I had it removed since I had insurance, and every time that it grew, I kept on getting surgery, which was very convenient to me because I have insurance. Unlike others, like they just let it grow and kept growing until it reached to their bones and it's big and it's already the whole foot, which most of the people who have this kind of disease, when they go to the doctor, it's already too late. It's already the infection has already reached the bone, so they had to really full foot amputation. But this infection can silently grow and eventually reach to the bones. So if you notice any unusual lumps or changes in your body, do not ignore it. Monitor it closely and always follow your doctor's advice, especially for rare diseases like this. Thank you for watching. If you found this helpful or if you're dealing with something similar, feel free to leave a comment or share your story. Don't forget to like, subscribe, and share this video to help spread awareness about actinomycetoma. Take care and see you in the next one.